So you went through with spine surgery. You were probably hoping it would be a new beginning, right? But the pain is still there, and you're just left with this one big question: why? If that sounds like you, then I'm glad you're here. We're going to unpack what's really going on, and maybe, more importantly, what can come next.
Look, I want to start by saying this. You did everything you were supposed to do. You did your homework, you weighed all the options. You found a surgeon you could trust. You put your faith in the science, in the procedure itself, and you went through it, truly believing this was going to be the answer. And now, you're here. You're in that incredibly frustrating, disheartening place where the solution you hoped for, well, it didn't solve the problem. And that experience, it can shake your faith in everything, in medicine and sometimes even in your own body.
So, let's really tackle those two big questions head on. First, what is actually biologically happening inside your body? And second, what does a real path forward actually look like from here? Okay, let's dive in.
The very first step, and honestly, this might be the most important one, is to completely change the words we use to talk about this. Because the language we use to define a problem, it shapes absolutely everything that comes after. For decades, the entire medical field used a term that you might have even heard yourself. And if you have, you know just how heavy that one word feels: failed. It's a word that doesn't just describe something, it assigns blame. It feels like it puts the burden right on your shoulders. And you know what? Experts all over the world finally recognize this. In 2021, an international panel said it plainly. This term has done enormous harm. Why? Because it suggests that someone, somewhere, messed up, that something failed. So the term was officially thrown out. The correct diagnosis is now persistent spinal pain syndrome, or PSPS. And this is so much more than just changing a few words. It's a fundamental shift in thinking. It moves us away from judgment and moves us toward understanding the biology of what you're actually going through.
Just look at the difference here. Failed back surgery syndrome sounds like a verdict, right? Like a judgment. But persistent spinal pain syndrome, that's a description. It's the difference between being blamed for something and being diagnosed with a condition, just like you would be with asthma or diabetes. The key takeaway is this: you did not fail. Your surgeon likely did not fail. You are living with a recognized biological condition.
And it's helpful to see the bigger picture. PSPS is a very real thing, affecting somewhere between 10 and 40% of people after lumbar surgery. But it's also really important to know that most surgeries are successful. The majority of people, that big slice of the pie, they get the relief they were looking for. Your experience is real, it's valid, and while you might be in the minority, you are far from being alone in this. Okay, so let's get into the why. How is it possible that a surgery can be technically perfect, yet the pain sticks around? Well, the answer is that the pain is often coming from more than just one place, not just the single spot that was operated on. Here are some of the common physical reasons. After any surgery, your body makes scar tissue. We call it epidural fibrosis, and sometimes that scar tissue can stick to or irritate the nerves. Or the levels of your spine above or below the fusion can take on extra stress, and that can cause new problems. We call that adjacent segment disease. And yeah, sometimes the original issue, like a disc herniation, it just comes back. Or maybe the surgery fixed one issue, but the real pain generator was a different joint all along. But here's the other piece of the puzzle, and it is arguably the most important one: central sensitization. Now, let me be crystal clear. This is not the pain being all in your head. This is a physical change to your nervous system. Think of it like this. After months or years of constant pain signals firing, your nervous system gets incredibly efficient at sending them. The volume knob gets cranked way up. The body's alarm system becomes so sensitive that it just stays on, even after the original reason for the alarm is gone.
This is exactly what neurosurgeon Dr. Kamal Woods is talking about here. The whole focus shifts. It stops being about what did the surgeon do wrong, and it becomes about what did the nervous system learn. It learned to protect you by being on high alert for pain. Fixing the structural problem with surgery is a huge step, but calming down that hyper-alert nervous system, that's the other half of the battle.
So this brings up a really important question. Are some people more at risk for this than others? And the answer is yes. But this is so critical to understand, because these risk factors, they are not your fault. This is about biology, not blame.
The research is actually very clear on this. Many of the key risk factors are already there long before anyone even mentions surgery. Things like how long you were in pain, your emotional state going into the operation, or if you've had spine surgery before. I just have to say it again. These are not personal failings. They're just biological and psychological realities that change how a person's body responds to and recovers from a major event like surgery.
And let's just put a number on it to show you how powerful this is. If you had pain for more than a year before your surgery, your odds of developing persistent pain afterward were more than double. Why? Well, a year is a long, long time for your nervous system to get rewired, to turn that pain pathway from a little dirt path into a superhighway.
And this leads right into the emotional weight of it all, which is every bit as real as the physical pain. Dr. Woods has this perfect phrase for it, a quiet devastation. It's that unique kind of grief that happens when the thing you put all your hope into doesn't work out. It's a loss of trust, not just in doctors, but sometimes in your own body's ability to ever feel good again. If you feel that, please hear me. It is a known, documented part of this journey. It's a sign of everything you've been through.
And we can actually measure this. The data shows that living with PSPS significantly increases your risk for depression, for anxiety, and for sleep problems. And that's not surprising, right? Chronic pain touches every single part of your life. So the point is, any treatment plan that's going to work has to look beyond the MRI scan. It has to treat the whole person.
Okay, so we've reframed the whole diagnosis, and we've looked at the biology behind the pain. That's the what and the why. Now we get to the most important part, the what now. And the good news is, there is a clear, evidence-based path forward.
The modern way to approach this follows 3 really logical steps. First, it all starts with a completely fresh evaluation to figure out exactly what's causing the pain today. Second, you move to targeted treatments for those specific things. And third, and this is key, you treat the nervous system itself, often with some advanced techniques called neuromodulation that can literally turn down the volume on those pain signals.
And look, this isn't just a theory. We have really good evidence for this. This chart comes from a landmark study comparing one type of neuromodulation, spinal cord stimulation, to just standard medical care. The difference is, well, it's huge. Almost half the patients who got the stimulation had significant pain relief. In the other group, less than 1 in 10. This is the gold standard of medical evidence, and it provides real, tangible hope. And all of this brings us to what might be the single most important thing I can tell you. It can feel really hard to go get a second opinion. You might feel like you're betraying the doctor you put your trust in. Let me be really direct about this. You are not. You do not owe loyalty to a diagnosis or a treatment plan that isn't helping you. Seeking another perspective is not an act of failure, it is a profound act of taking care of yourself.
So let's end on this thought. This persistent pain, it does not have to be the end of your story. With a new way of understanding it and with new tools to treat it, this can actually be the beginning of a brand new chapter. A chapter that isn't defined by what happened in the past, but by the smart, informed choices you make for your future. The only question left is, what will that next chapter be?